So now we are going to present our roundtable. You can come to the scenario if you want. So we have 4 wonderful speakers today. We are going to discuss about trends, needs, and solutions in digital health for chronic diseases. And in the meanwhile, as some of you know, one of the objectives of this forum is not only to raise money for the startups that presents, but also to generate awareness about the topic that we choose, right? So in this sense, just to give a little bit of information about what is happening in Catalonia, Christian was talking about that Barcelona Health Hub being one of the biggest digital health hub in the world, probably. So in the past year, we've seen an increase of 30% of digital health startups in Catalonia, and these digital health startups have raised 63 million euros last year, 2021, which is similar to what biotech have done. I mean, biotech was 66 million euros and digital health 63. So this is a data that confirms that we're in the right path, right? And then, well, we have TechMed with 104 million euros raised during 2021. So with no further ado, here we have the panel. Thank you very much for accepting the invitation. And now I will give you a moment to introduce yourself and tell a little bit about why you're here and what you can add to the table. Thank you. Patricia. Yeah.
Okay, my name is Patricia Pothorosic. I'm a neurologist. I think I'm representing the table, a healthcare provider, so I'm a physician. My specialty within neurology is migraine, headache, some prevalent, chronic, lifelong disease that affects mainly in the best years of our lives. So mostly also women. Not only, but mostly, and it is extraordinarily debilitating. This is the proper word to use. And it's considered as the 7th most debilitating disorder by the World Health Organization, and the first one amongst women between 20 and 50 years old. So it is a true, I would say, chronic neurological disease. So in order to give access, as before it was said already, we have tried already since a while. I always say that medicine evolves with technology. So when technology provided the way of accessing patients in different ways other than just by a physical interaction, we created 10 years ago the first website in Spanish. The name of it was Mi Dolor de Cabeza, because we thought it was an easy way to find it in the internet. And we did this because when you look at it, 1 million searches per month are done to find some word that is related to headache. This is the need that is out there that is probably not properly reached. And 4 million searches are done with a word in English. So either headache, migraine, or something similar. So there is a need for this. And we tried to provide a solution, a place where you could have not only information to educate, but also tools to monitor. And those were thought both for physicians and for patients or even families with someone affected by the disease. So probably this is one of the reasons why I'm here. Other than that, I have a research group. So I coordinate, direct, I'm responsible to do research both at a preclinical and at a translational and clinical level. And within that, we are in the process of patenting different solutions that will enhance diagnosis, which is something that in a disease that looks so invisible as migraine seems somewhat difficult perhaps to grasp. We are working on analyzing molecular changes in saliva, in epigenetics, and we are also in the process of validating solutions to predict migraine attacks through non-invasive devices that we all use nowadays, such as smart watches, or, for example, also the use, for example, what nowadays is called social sensing, which is the use of your phone and how you're actually using it. And maybe that can predict something that fluctuates with time, which is the presence or absence of attacks. Because our disease, or the disease that I take care of, actually comes in and out of cycles, and it creates a lot of anticipatory anxiety for those who suffer from it. And it is, interesting for them to have solutions that actually might help them predict what might happen. So probably the goal here is to try, what patients are looking for, to understand who they are, where they are at, what solutions they're seeking and looking for, and then trying to provide, solutions or ways of helping them manage their disease better, with a typical word that we all use and want to I think, yes, use a lot, which is empowering patients and providing personalized medicine through precision technology, I would say, and including the patient. And that's what digital probably does a lot, which is making them participate and really create a bond, so to have a win-win solution together with patients. So I think that's why I'm here. Thank you.
Thanks. Annabel.
Hello. Okay, my name is Annabel Leon. I am working at Bayer, okay, as digital lead for pharma, but also in leading the vertical of pharma in our new Life Hub. Okay, Life Hub is an open innovation concept that exists in Bayer. Okay, and it's that the Life Hub tries to connect and co-create with the innovation local ecosystem. That's why in our case, we are focused in digital health and digital therapeutics, because it makes a lot of sense because of our ecosystem. And we are working with partners like Barcelona Health Hub, for example, okay? We are trying to address several challenges. And one of them, okay, is the early detection and deterioration of chronic disease, in order between some things to assure that we are giving the right treatment to the right patient at the right moment. It's very important for us. So, well, I think that's all from my side. Well, I think that I am here because just to bring to the session the vision of the industry and the experience around digital health and chronic disease.
Yes, we will talk about complementary right afterwards as well. So, yeah. Maria.
Thank you. Good evening. My name is Maria Salido. I am the CEO and the founder of Social Diabetes, which is a startup created in Barcelona, based in Barcelona, but we are working mostly in Latin America, from Mexico and in the rest of Europe, by establishing alliances, commercial alliances with some partners. Our product is a solution consisting of a mobile app for patients, for self-management patients, and a website medical platform for remote monitoring. So Social Diabetes is a digital therapy that provides treatment support and decision support to the whole system. We were born perhaps too early, 10 years ago, because the maturity of the market was very complicated to operate. We were born because my business partner, Victor, was diagnosed with type 1 diabetes, and he didn't understand why in the 21st century, the diabetes management is still managed by manual paper looks and physical visits to the doctor. We create a solution, and we have been working with industry, with governments, and I am here, I think, to represent the complexity, the challenges, and the way of the startups. So welcome to all of you, or the startups, and very good luck in this trip.
Thanks for the invitation, Nadia, and all the organizers. I'm the managing partner at Esade Partners. Esade Partners is a venture capital firm based here in Barcelona, investing across Europe and investing what we call across the board in health innovation, which means we invest in biotech, biopharma, but we also invest in health tech. And that means pure hardware, medtech, and also pure digital and everything that is beyond those different type of products and companies. When we founded Esade Partners in 2018, we strongly believed that the hopefully very close future will be in a way where patients will be managed by different or with different tools, or probably managed by teams of MDs and other type of experts, and using different type of tools such as classical drugs, gene therapies, medtech digital implantable solutions, and apps, and many other things, right? And not only for the concrete acute treatment of something, which also can combine these different type of tools, but also particularly for the chronic treatment and in the prevention or prediction setting. So COVID helped us in accelerating this. So COVID brings also some nice things and the need was exactly that, right? So we've been investing since then. We've invested in 12 companies, and 4 of them are pure digital, aiming to provide solutions to chronic patients. Some of them are only focused in chronic management, others are also across different type of indications, but including also chronic. And some companies are here in Barcelona, others are abroad. And what I would say is that we are absolutely amazed on how this technology is being incorporated. Not easy, but that the acceleration that we are facing there is amazing. There are many new opportunities coming. We receive many opportunities every week on investing in these type of solutions. And I think that it will be very interesting to see the opportunities today and the discussion now with the rest of the panelists.
Thanks. So since you're saying that we are going ahead on implementation, but that's something that we have to still work on, I would like to talk about the barriers, right? I have here Patricia, which is in the front line of these barrier implementations, but then also Maria, who can talk a little bit about why did you have to go to South America, right, to implement something, because in Europe the regulatory framework was harder. So, when we were preparing this roundtable, we were discussing about some characteristics of digital therapeutics for chronic disease, right? Like remote monitoring, health and health data security, lack of precision. That's a barrier that we have now. Difficulties in the approach of the disease, clinical trials, personalization. What can we discuss about this, Patricia?
Well, I think everyone can give a different perspective on what you're mentioning. So I think you're wanting to focus more on barriers first, and then we'll see what we can do for them. I think chronic is a complex word. And that's the first challenge for all of us when you think about chronicity. Because think about yourselves. Empathy is the perfect way of, I think, trying to understand where to invest and then understand what patients are going to need, or people in general. Because the problem with chronic is that it is hard to be consistent in providing data that actually helps us make decisions, which is what we more or less want. So that's the first challenge, I would say, which is how can you acquire information, digital information, that is sustainable in time. And I think that's a challenge, because sometimes there's a one-shot diagnosis or treatment that maybe like hepatitis C, you have just one treatment and it just solves the issue, but then it's not a chronic disease. So chronicity has this challenge, which I think is very important. The second one, I think, is the other challenging word is digitalization, because when I hear digital, I understand data. I understand that they have to talk together, and how can we then extract interesting information. So it's quality of data, another very big challenge, and how databases that are in different parts actually blend with each other. I think that is going to be a certain challenge for our healthcare system. Probably the fourth big barrier is public health. So Spain, I think we are all very proud of our public health. We all work in well, maybe not all of us, but many of us work in the public healthcare system. And those have challenges in relation to cost effectiveness, in the sense of what can we actually pay? And even if we might think that digitalization is cheap, it has certain challenges. And the speed, the acceleration that you have in investments doesn't always translate at the same speed to practice, and those has a lot of regulatory or legal reasons that actually are difficult to manage when you bring it to the big public and try to do properly, you would say, medicine with it, because for you to have an idea, and maybe some of you have, I'm your physician for some of you, and you've seen, if you come to my outpatient clinic, that I am faced with at least 2 screens more usually. And I have 2 or 3 different programs. One is with the diary that the patient brings, and then I'm trying to copy and paste, in the actual story of the hospital, so that it stays there and someone can see it. And we all want to have access to this information. So I think that really moving into the, I don't know, it's the 4th generation or 5th generation almost of internet, and how we have all of this data that are mobile and use them is going to be probably another challenge. I leave the rest a bit, not I'm going to talk alone.
Yeah, basically data quality is
Data quality is very important, and data, how you actually blend them. It's the quality of the data, and then having different bits and pieces of information, and how they all should merge into one place that you can actually access it in the same language. So that's
you can replay each other if you want.
This integration of data is absolutely, it's a madness. Yeah, it's a real barrier.
Yeah, I think that then the question is, who's gonna push for that, right? So I think that the answer to the barrier is, who's gonna push for that? And let me continue with the good news if you want, and particularly in some markets like the US, where it's easier because the system, the healthcare system is different and much more keen to accept and to apply these technologies, because they are much more reactive to saving costs or saving timings or things like that. So sometimes the US is a kind of a training field for some of our companies, and of course a huge and important market. But we do see, and I think that's very optimistic, I think that's a good news, that the payers are really prosecuting this kind of things. So I think that they've seen the value of that, particularly in the chronic indications. And I think that the way of pushing that forward is generating clinical evidence. At the end of the day, if you are able not only to show pharmacoeconomics, but also clinical evidence or some things, and I'm just bringing a Nature paper that Coa Health published this last month in May. So just imagine a digital company spin-off of Telefonica based in Barcelona, between Barcelona and the Netherlands, with more than 4 people working here in Barcelona, that has published a paper in Nature Medicine. So just try to fill the gaps, right? And that's for me the good news of it. Showing that their algorithm, their machine learning algorithm that they built by using electronic health reports of patients was able to predict in advanced mental health crisis, right? And not only in a retroactive study, but also when they challenged themselves in a proactive study, they were in a not proactive, just in the future study. Exactly. So they were able to predict that, right? So I think that's also important. So generating the clinical evidence beyond this type of tools, it's also what's going to make the whole system and the whole society to push for that. And payers, not only pharmas and not only the users and the patients, of course, but also payers will be a key point for that, and starting for some concrete markets where this might be easier.
I think that one of the things that you will all realize, I think in the healthcare system, the payers, so Barcelona, CatSalut here in Catalonia, I personally, we are more condensed in ILICS, Institut Català de la Salut. I think that they were trying to find a solution. At one point, we were trying to find a one size solution for all. And we've come to realize that this is not going to be possible. We are going to have different solutions for different types of diseases. And then in order to develop that, you just cannot have all of the knowledge and all of the abilities to do that. And then you will need to co-create with different types of companies, solutions for each of the patients, groups of patients. So I think that this is something that is growing, we are starting to understand that this is going to be a need. And although I don't have right now the hat of, a public healthcare providers in a way, it is like if I did, and I realized that it has really changed in the last 10 years when I also started to think about developing solutions for patients. And now they are starting to realize that maybe we are in need of probably developing something, for example, for migraine, something for, let's say, diabetes, or for congestive heart failure, because the needs and the prompts, that data that we have to extract from patients in this aspect is different from the one that we might need for other diseases. And for now, I think our healthcare system has really developed solutions for acute problems. And now I think the challenge is going to be chronicity and diseases that kind of run with you, a long life. And this is something that is probably in the next, one of the next steps at least.
I also agree, of course, that data integration is a huge problem, okay, and more within in the fragmented market that we have in Europe, even in Spain. So sorry, only to go to Europe. But for me also, there are two barriers that are important. One is regulation, that is not, let me say, following the speed of the market. And that it's a barrier when you try to do something, implement some solutions. But the other is the adoption. The adoption in both sides, from the healthcare professional, how you could include this new digital solution in the flow that he or she has, okay, already. But also the adoption of the patient. Is very important. With the digital health solution, you have to cover a real unmet need. Okay, yeah. So to assure that the solution will be used, but also it's important to empower the patient, because especially in chronic disease, and well, I don't know whether you think that you have more expertise than me, but I am a chronic patient, okay, so maybe I could talk something about. I think that when you receive the diagnosis, you think, okay, that this is what it is. I will have this disease for a long time, forever, okay, and that's all. But if you empower the patient could be part of the solution and look for solutions, and then use these kind of solutions. If not, it's difficult that the patient will use it. I think this is a lot of work to do to empower the patient. And this is one of our challenges that we would like to address, empower the patient, so could maintain another kind of conversations with with his doctor or her doctor, okay? So could be part of the solution, could be part of the decision making, okay? Because he or she has the information.
I was saying before, right, that the 4 million people were searching for migraine in English, right? Each day.
Per month.
Per month.
Per month.
So that's a lot of people.
That's a
So
lot of
patients want to know, I mean, the medical doctors are facing a more informated patient right now as well.
And there is a risk. If we don't do it, Dr. Google will do it.
Yes.
We are implementing expectations in the case. But I think the patients are always ahead, the industry and ahead the governments. So the problem is industry and the ecosystem in general, we are not providing the right tools to the patients to take the control of their lives and to manage and deal with their daily conditions. This is a very interesting debate about very specific tools for a specific illness and a generalistic platforms, because it's all the sector are trying to understand what's the right combination of the two approaches. And I think the data lakes and the interoperability is the solution, because no matter the tool that you are used, the problem is where are you putting your data and what's the sources of that data. In our experience, the main barrier, especially here in Spain, have been the technological literacy, because it's a matter of culture. Because if you are in front of a decision maker, whether a payer or a care provider, and they don't understand what technology means, what technology could be applied, what is going on in the world, if they are living disconnected of this digital world, they won't be brave enough, they won't be willing to venture to implement anything because they feel weak or in a trouble or in a risk. So for me, this is a very strong barrier. And the second barrier is bureaucracy, not only regulation, but bureaucracy in general, because bureaucracy and innovation is a it's a speed. So we cannot wait for 4 months just to decide to make a pilot. We don't need to spend 3 years just to see our solution in the public healthcare system. So it doesn't make sense.
A faster way should be.
So at the end of the day, the startups just to need to look for some mavericks in the organizations, because in our organizations, there are people who feel brilliant people who are trapped in organizations, and who are willing to take the risk, willing to implement, but it wouldn't be the solution. No? The solution is a transformation of the culture of our country and reduce bureaucracy, because bureaucracy is repeated 17 times, because if you solve a problem here in Catalonia, you will face the problem from scratch in Galicia or in Andalusia. No? That's the reason why Spain is a trick.
So before you were talking about validations as well, no? And the difficulty of having a right clinical study or
I think that's part of the failures. I mean, whatever is going to be presented afterwards, think about doing proper validated studies, because then if you don't really test it according to what is needed, you will see that finally it doesn't predict as perhaps it was expected to predict, or it doesn't predict always. So the complexity of diseases, unless you have, I think, good scientists / physicians beside you, and maybe wise patients, or that micro experts, I call them, they know more about their disease than we do, maybe you risk to fail within the solution.
That's something that investors definitely look for, right?
From my side, first regarding the integration of solutions, and we have seen many companies and many products going into a very niche specific area, and particularly in the chronic field, that's not easy to handle and not easy to implement at all. And what we've seen very successful is this type of companies that create solutions applying modules, so that you can play with the modules, and particularly because a chronic patient is quite unreal. Usually you have multi-chronic patients. So, and then this need of integration and modularity, and probably not personalized medicine, but something that it's trying to get there, right? To have a particular set of solutions for this type of patients. And particularly in the digital therapeutics part, where you really want to handle the patient outcomes. I mean, you want to change the patient outcomes by using digital tools, and that's possible. That's already been validated in different clinical trials. So modularity, it's probably one of the, which will allow scalability at the end, is probably some of the I would say, keywords that I would suggest to entrepreneurs and to companies to have in mind. That's the first part. And second, with regards to bureaucracy, which of course is a lot, and regulatory, we feel that there is a huge difference between companies that come from the technology side and that want to apply their technologies into the health innovation systems. And that's usually very different and probably frustrating for them. But that's different from the companies that started from the health innovation of life sciences field, because they are already aware of the rules about, I mean, there's no one that was started in the health ecosystem that thought that they could put something out there without any type of regulation and have a final user, a patient, and that's it, right? That's not going to happen probably, at least not if you want to do change or critical changes into what's going to happen with patients and medical decisions. So I think that probably some of the conversations we are having are not that different from when people were starting to think on how to apply, how to conduct clinical trials, and how to implement gene therapy, I would say, right? So I think that we should have this in mind. There will be ways we will need to create and provide creative solutions on how to implement these things, because usually technology, startups, innovation will come a bit earlier than how regulatory and the final players will be able to implement those things. So I think that creating the story, creating the way we want that to happen, and explaining that will be much successful than just waiting things to happen, right? So.
Yeah, definitely. So while the audience here is thinking about any question that you might have, we have to finish now. That it's a pity, it's really short time. But if you could make a wish, just one sentence about what will you change right now or tomorrow in the terms of your area of expertise and digital health and chronic disease. I don't know, whatever, you don't have to
I'll be the
start.
last one.
Okay,
then.
yeah.
Okay. I'm thinking something bright to say.
You're at the end of the innovation.
To see a public sector as a platform to interact, to create success cases, and to dynamically test our products in our country to go out better prepared to show success.
So the stress on the public sector.
Because as she said, so hopefully we have a very strong public sector, which is nice, but it's also a barrier, especially if it is too fragmented, as in the case of Spain.
On my side, probably patients claiming to their MD teams to provide this type of tools. I think that's starting to happen, but that will be the final trigger of some of these things.
For me, I think that it will be the regulation and legislation will follow the track of the market. So could accompany in order to implement and develop solutions that will cover unmet needs of the patients.
I have to say that probably I would have one wish is that public-private investments really start crystallizing and transforming health for patients. I still think that we are not able to connect each other to provide the solutions that would be cheaper actually, and many times quality enhancing and life-saving. So I would keep that one as a wish for the next
On the
years.
private side.
Yeah.
That's great. Thank you very much.